Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Cardiovascular disease is the leading cause of death in women, yet many still remain underdiagnosed and undertreated. According to the American Heart Association, 45% of females 20 years of age and older have some form of heart disease, and 1 in 3 women will die from a heart-related condition. So what can we do to change those numbers? Today, in honor of American Heart Month, we're talking about women's heart health and what you should know about taking care of your heart with Dr. Lakshmi Muthukumar, a cardiologist at the WVU Heart and Vascular Institute. Welcome, Dr. Muthukumar, to Live Healthy West Virginia.
Thank you, Mary. Thank you for having me here.
Well, we're excited to have you here. We got a lot to talk about today.
Absolutely.
So let's start with, we just mentioned how heart disease in women is underdiagnosed and undertreated. Why do you think that is?
I think it is lack of awareness. That's the number one cause. There's still the myth that it's primarily a man's heart disease. Mm-hmm. And still people are thinking that breast cancer is the number one leading cause. We still have that myth floating around. And women tend to present sometimes not with the typical symptoms. Mm-hmm. Sometimes they present with like a vague, just like fatigue or something like that. And they're also afraid that they might be dismissed when they actually say that I'm having head chest pain or I think I'm having a heart attack. There's that social fear of being dismissed.
Sure. So yeah, you mentioned that they can present differently. Can you tell us what to look for? What specific symptoms are different in women than in men with heart disease?
So women can have chest pains too. In addition to chest pains or pressure, they present with other conditions. Like they would say that I have nausea, vomiting, heartburn, sometimes like upper abdominal pain, sometimes back pain, jaw pain. So these are the symptoms that would sway them away from like, maybe something is not right. I just feel fatigued today. Maybe it's something that I didn't sleep well. So half the time they blame it on themselves. Yeah. And they don't seek medical attention. And it's not that they don't present with chest pressure or anything. They will have chest pressure, but they have all these associated things that go with it, and then to top it all off, when they have chest pressure, they also have anxiety because they're like something is wrong. And they're very anxious, and sometimes that anxiety would take them away from their actual symptoms.
You're thinking I might be having a
panic attack. Exactly.
Mm-hmm.
And because they have that bias in them, when they present, they bring that up front, and sometimes the physicians treating them feel that, oh, maybe that's what it is, that's why it can be wrong.
Yeah. Is it true that some women won't show many symptoms at all?
It is not just true for women. When you're a diabetic and your blood sugars are not well controlled, you can damage some nerves. So pain might not be the presenting symptom in that cases. And that's why, and because you have a variety of symptoms as well, which are not typical of chest pain or pressure, it can be different in that case.
Okay, well, that makes sense. So what are the risk factors of heart disease for women?
The common risk factors that affect men are the same common risk factors that affect women as well, like hypertension, poorly controlled diabetes, high cholesterol, which is not taken care of if not on medications to control it. Of course, stress, any stress, like emotional stress or any stress that runs. Depression is also a risk factor. Smoking is a big risk factor as well for thing. And there are other risk factors that people are not aware of, like if you have underlying conditions like autoimmune conditions, inflammatory conditions, these are all also risk factors that a lot of people are not aware of.
And unfortunately, we're facing, you face that unique population here in West Virginia because unfortunately, we lead the nation in things like heart disease, diabetes, smoking, all that bad stuff. That's a challenge, isn't it?
It is. I think the health literacy probably is number one reason. Like people are not aware that these are risk factors. And obesity is so prevalent too. They don't. And also I think because of the lower socioeconomic status, maybe like access to healthier foods, or not even being aware what are the healthy foods. The healthier foods sometimes are more expensive, and
Right.
fresh fruits, vegetables, unprocessed food, all these are sometimes not affordable, sometimes lack of awareness that this is what they should eat.
Right, right. So, what steps can women take right now to take care of their heart and to prevent heart disease?
Primary prevention is always the best. By primary prevention, having regular follow-ups or seeing a primary care physician is very important. You don't have to see a cardiologist, you can see a primary care. Because once you see a primary care regularly, they're going to check your blood pressure, they're going to check your blood glucose levels, they're going to check your cholesterols, and they would they would treat you if you have this at an earlier stage, so that they would prevent you from actually having a heart attack. I shouldn't say prevent you, but at least if you control these risk factors, there's a very high chance that you are not going to have a heart attack.
Create the awareness
Exactly.
of what to look for.
Exactly. And also, as I said, like obesity, healthy weight is very important. Like if you're smoking, no matter even one cigarette, 2 cigarettes, doesn't matter. If socially smoking, excess alcohol, none of these are good for your heart. So all that's something you can take care of yourself,
Yeah, just quit those bad habits now.
Exactly.
Yeah. What are the most common kinds of heart disease that you find in women?
Atherosclerosis, the common heart attack, that's the most common.
Is that coronary artery disease?
Yes, it is coronary artery disease, but it's because of high cholesterol leading to plaque buildup, which can cause blockage or occlusion of the vessels. That's the number one reason for having heart disease, right? But in addition to that, women can have other conditions like spontaneous coronary artery dissections. As I mentioned before, they have inflammatory conditions like autoimmune or inflammatory conditions like lupus that occurs more in women, and rheumatoid arthritis. These inflammatory conditions can also aggravate your atherosclerotic process in women.
Okay. So let's talk about that. You mentioned spontaneous coronary artery disease, and that's also known as SCAD, correct?
Yeah, coronary artery dissection, because that dissection, the artery dissects and closes off. That's what it is.
Okay. So so that's what it is.
Mm-hmm.
It's essentially splitting?
Actually, the inner layer, there's always this wall through which the blood vessels carry blood.
Yeah.
And the innermost layer sometimes would like tear up, and they would occlude the coronary arteries. And that can occur in women, mainly like younger age women, sometimes in women, like it can occur during childbirth or in the peripartum period.
Okay.
Sometimes it can occur at the age of around 40. Usually these are younger women, it can occur.
And that leads to heart attacks, strokes too?
Yeah. So not really the stroke, because when it occurs in your blood vessels supplying the heart, it causes heart attacks.
Okay.
So you could be like a 25-year-old, and sometimes you can have like that, and you can have excruciating chest pain because you are having that dissection happening right there when you're extremely stressed or anything like that. Yeah.
So what are the risk factors for SCAD?
So if you have hypertension that's not well controlled is one of the risk factors, but also if you have other conditions like Ehlers-Danlos or Marfan's, where actually these conditions cause weakening of the artery walls, that can also cause SCAD. And sometimes we cannot find a reason. We have women, we work them up, and we are not able to, extreme stress they present, and we're not able to find a reason as to why they had SCAD. But we have a complete workup we do when they show up like that.
Are the symptoms any different when you have SCAD? Is it like what we've already talked about?
No, like as I said, the symptoms are because like you're occluding the blood flow, right?
Including means stopping.
Yeah, closing down the arteries, and the muscle doesn't get any blood. So the muscle is suffering. It's called ischemia when the heart muscle doesn't get blood, and that aggravates your pain. And so chest pain is, when you have SCAD, you usually have excruciating chest pain, which can radiate to your back or jaw or anywhere in the neck or anything like that. So it's very similar to actually having a atherosclerotic process. When you have a plaque rupture and there is total occlusion, meaning that the vessel closes off, that's exactly what a SCAD could do.
Okay. Is it treatable?
Yes, it is treatable. You will obviously, when you have to show up to call 911, show up to the ER. And once you show up to the ER, they would take you for a cardiac catheterization and see if you have this condition. If this condition is present, then they would treat your risk factors. Depending on where it is, that's how the treatment will depend on. It is treatable. And you need medications to prevent a future one, making sure your blood pressure is well controlled to prevent a future event.
And I think a common thing a lot of, not just women, but just people in general do is, it'll get better. I'll wait it out. And like, it sounds to me like earlier intervention is better.
Yeah, there's a saying, time is muscle, because like anything else, the muscle, if the muscle doesn't, heart is made up of muscles as well, right? If the muscle does not get enough blood supply for a prolonged period of time, it's going to die. The muscles are going to die. The dead tissue cannot be brought back. So at the first sign, seek medical attention. If it is like calling 911 or talking to your doctor or whatever it is. So if you think you're having a heart attack, call 911. You don't want to drive yourself. You don't want to have a friend or a neighbor or anybody drive you. Call 911. It's okay. Better be safe than sorry. It's okay. Even if you don't have an heart attack, it's okay. But that's why physicians will tell you what it is, right? You don't have to make the decision yourself.
Right. That's what your job is.
Exactly.
And you also mentioned that people with autoimmune diseases like lupus and rheumatoid arthritis, that they're at higher risk for heart disease. Why is that?
It's an inflammatory process. The atherosclerosis, meaning that plaque built up in your coronary arteries, is actually an inflammatory process that's happening.
It causes
this would aggravate the atherosclerotic process, and that's why it is so important to make sure those autoimmune diseases are under control, because if it's not under control, it will actually aggravate the atherosclerotic process everywhere in the body.
Okay. All right. Good to know about that. So what can people with RA and lupus do? Should they be on the lookout for the symptoms we've talked about before, or is it more important to just keep their existing condition, lupus or RA, under control?
It is very important to keep their existing condition under control. And if they have like symptoms of heart problems, I would recommend them see a cardiologist, so the cardiologist can be very aggressive with primary prevention, like, as I said, like you want to be aggressive with controlling their lipids and like, putting them on medications that will lower their blood lipid levels to prevent the atherosclerotic process.
Okay. When we were talking earlier before the show, you wanted to talk about microvascular disease. Now I understand it's more common in women than in men. So what is it and what are the symptoms?
So this used to be called syndrome X, because meaning that we didn't know what was causing it earlier. They call it syndrome X, meaning that women had it more often than men. So when you don't have blockages in the main vessels supplying the heart is supplied by big vessels, then you have the small vessels that you cannot see with your naked eyes or anything like that. Even by a cardiac cath, you cannot see those vessels. These are embedded inside the muscles and you cannot see them. So when there is no blockage in the main vessels, people can continue to have chest pain. And people would say that when women complain of chest pain and they've had a cath which didn't show any blockages, people say, before, you were crazy, it's up in your head. But now we know clearly they have endothelial dysfunction, which is actually causing microvascular dysfunction, which prevents the muscle from getting enough blood. And that's why they are having pain. So it's been very well studied right now. I mean, it's still a lot to be studied, but I think at this point we at least know that these people don't have major blockages, but the underlying small vessels are not getting enough blood supply. That's called microvascular dysfunction.
Okay.
Yeah.
So we shouldn't be telling ourselves, oh, this is all in my head. Or even if somebody else tells us it's all in our head, we shouldn't necessarily accept that.
Yes. We shouldn't necessarily accept anything which people say that it's all, as I said, microvascular disease. There are diagnostic sets that can prove that you have microvascular disease right now, which we'll get to. However, as I said, it should be a diagnosis of exclusion when you don't have major blockages. It's very important to rule out major blockages, and then you can say if you continue to have chest pain, it's most likely microvascular disease.
Okay, so let's talk about that. How do you diagnose and treat microvascular disease?
So before you actually go to how to diagnose, I want to talk about the risk factors.
Oh, yes.
Because it's the same risk factors that causes macrovascular disease, meaning the major blockages, it's the same risk factors. Diabetes, hypertension, these are the same risk factors that actually cause microvascular disease as well.
Obesity?
Yeah, definitely. Obesity is like an elephant in the room. It's so obvious, actually. So these are the same things. So you first have to exclude macrovascular disease, as I said, by either a coronary CTA or a cardiac cath or this thing. Once you exclude that, a PET perfusion study can actually show that you're having decreased blood supply to the muscles, and that would tell you that you probably have microvascular disease.
Is that like a PET scan?
It's a
perfusion study?
It's like a PET scan. It's a PET stress test that you do.
Okay.
And cardiac MRI stress test can also show you decreased perfusion to the blood vessels.
Okay.
And although not routinely recommended, sometimes if you do an invasive cardiac cath and you put special catheters, you can determine that they're having microvascular dysfunction. But as I said, before you go to microvascular dysfunction, you have to make sure that the major vessels are not blocked off.
Not blocked. Okay.
Or at least the major vessels are are opened up or something like that.
Okay. So how do we treat?
Microvascular disease we treat with medications like nitrates or calcium channel blockers or beta blockers. These medications are also used for treating hypertension, and it basically anything that would vasodilate the blood vessels, reduce the demand of oxygen. That's what we do.
Okay. Well, that seems pretty simple. I expected that to be more complicated.
It is complicated because despite all this treatment, people continue to complain of macrovascular disease. But this is what we have with the current day in literature, these medications. I'm hoping maybe in the next few years, they'll come up with these medications specific for microvascular.
Okay.
But right now, these are the medications we have. I always tell people it's not a magic wand. We'll have to go rule out one thing at a time.
Right. Okay, so you were talking about all these tests and everything. So, I mean, this is the time I think we need to talk about the WVU Heart and Vascular Institute and the expertise of the team at the WVU Heart and Vascular Institute in detecting and treating heart disease in women and men, in everybody.
Exactly. The team is all about primary prevention, right? So even when you don't have symptoms, if you regularly follow up with a doctor, they're going to make sure your risk factors are very well controlled. One of the biggest risk factors that you can't go back in time and you cannot change is your genetic risk factors. But the factors that you can change, even if you're smoking and you're not able to quit smoking because you have the craving, we have the team that can help you with patches or medications to decrease your craving. We have the weight loss clinic that can help you get it to an ideal body weight. We have medications that can help you with your obesity. So I think if you start seeing a primary care physician, even when you're not having symptoms, that's the place to start. And when you have symptoms, we have all latest equipments that can detect all these plaques and atherosclerosis at a very early stage, so we can be very aggressive with further buildup.
Yeah. And when you mentioned earlier and just now about, seeing your primary care physician regularly, what's the definition of regularly? How often should we be seeing our PCP?
If you have no symptoms, at least a yearly follow-up for blood tests is essential. They'll check your cholesterol levels once a year, or if you have anything like hypertension or diabetes that's not well controlled, they can see you more often. They can refer you to an endocrinologist who can better control or give you some expert opinion for controlling diabetes. So if you have no symptoms and if all your numbers look great, you can see them once a year. If there's something wrong. You might have to, depending on each patient, you might see them more frequently until we get this all controlled.
And if it seems so too intimidating to lose weight, control diabetes, quit smoking, there are teams to help you with it. You're not alone.
You're not alone. They even have the cardiometabolic, because a lot of people who are obese have heart problems. They even have the cardiometabolic clinic where they have combined and like a multidisciplinary approach to treat these patients.
Okay. So before we wrap things up here, I always like to ask, what's the most important thing you want our listeners and viewers to know about heart disease in women?
I want them first to increase awareness. Like women always tend to put them last. They dismiss their symptoms. They're usually the primary caregiver on most households. So every time they have a symptom, they dismiss it. I think treating you first is very important. Putting yourself first is very important when you have symptoms. And as I told you, being aware of the risk factors and what you can do about changing. Some risk factors you can change. Some risk factors you cannot change. Let's leave the genetic component, which you cannot change. Let's work on the ones you can change.
So awareness, see your PCP, take care of yourself so you can take care of everybody else, right?
Exactly.
I don't know why this is so prevalent in all of us, but it just is, right?
It is. I think it is evolutionary. Women are so used to taking care of their family and always putting them. It's an evolutionary process, which probably needs to change a little bit.
Yeah. We need to work on that now.
Yeah.
We'll try. We'll try. Well, thank you so much for sharing all this information with us.
Thank you for having me. It was a pleasure speaking to you.
All right, great.
Thank you.
We learned a lot today, and I think we'll be helping a lot of people, so thank you.
Welcome.
That brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about heart health, visit wvumedicine.org/heart. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the new Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Muthukumar and everyone at WVU Medicine, thanks for joining us.